Question 1. A pharmacy technician receives a prescription for lisinopril 10 mg number 30 sig, ITAB per daily. The patient requests a 90-day supply. If the pharmacy allows 90-day supplies, how many tablets should be dispensed for the 90-day supply? I. 30 tablets. B. 60 tablets. C. 90 tablets. D. 120 tablets. Answer C. 90 tablets. This question tests your ability to calculate the day supply for a prescription, which is a fundamental pharmacy math skill. The keyword 90-day supply directly indicates the duration for which medication needs to be provided. Since the original prescription instructs ITAB per daily, 1 tablet by mouth daily, for a 90-day supply, the patient will need 1 tablet per day multiplied by 90 days, totaling 90 tablets. Always ensure the quantity dispensed matches the prescribed duration and dosage, which helps prevent patients from running out of medication. Question 2. Which of the following drugs is a common example of a statin used to lower cholesterol? I. Metformin. B. Omeprazole. C. Atorvastatin. D. Amoxicillin. Answer C. Atorvastatin. This question evaluates your knowledge of common drug classifications and their uses, a key part of the top 200 drugs list. The keyword statin refers to a class of medications primarily used to reduce cholesterol levels in the blood. Atorvastatin, brand name Lipitor, is a widely prescribed statin, making it the correct answer. Metformin is for diabetes, omeprazole for acid reflux, and amoxicillin is an antibiotic, so understanding these drug classes is crucial for patient safety. Question 3. A prescriber calls in a prescription for alprazolam. Which of the following is required information for this prescription that a pharmacy technician must verify? I. Patient's weight. B. Prescriber's DEA number. C. Patient's insurance policy number. D. Patient's preferred pharmacy chain. Answer B. Prescriber's DEA number. This question assesses your knowledge of controlled substance regulations, a vital component of pharmacy law. The keyword alprazolam is critical because it is a schedule for controlled substance, meaning it has specific legal requirements. All prescriptions for controlled substances must include the prescriber's Drug Enforcement Administration DEA number to be valid. This regulation helps track controlled substances and prevent diversion, ensuring patient safety and adherence to federal law. Question 4. What is the primary purpose of a lookalike/soundalike lossy medication list in a pharmacy? I. To identify medications that are manufactured by the same company. B. To assist patients in recognizing their medications visually. C. To minimize the risk of medication errors due to similar names or appearances. D. To categorize medications based on their therapeutic use. Answer C. To minimize the risk of medication errors due to similar names or appearances. This question focuses on patient safety and quality assurance within the pharmacy, a critical aspect of pharmacy technician responsibilities. The keywords lookalike/soundalike directly highlight the issue being addressed. Drugs with names that sound or look similar, like celecoxib and Celexa. The primary purpose of identifying these medications is to implement strategies, such as tall man lettering or separating storage, to prevent dispensing errors that could harm patients. Recognizing loss of drugs helps technicians contribute significantly to patient safety. Question 5. A pharmacy receives a new order for a medication that requires refrigeration. Upon arrival, the delivery driver informs the technician that the refrigerated products were accidentally left out at room temperature for an hour. What is the technician's immediate next step? I. Dispense the medication as planned, as an hour is a short time. B. Place the medication into the refrigerator immediately and document the temperature excursion. C. Contact the wholesaler or manufacturer for guidance on the stability of the product. D. Return the entire shipment to the wholesaler as damaged goods. Answer C. Contact the wholesaler or manufacturer for guidance on the stability of the product. This question tests your understanding of proper medication handling and quality assurance, which is crucial for maintaining drug efficacy and patient safety. The important keyword refrigeration indicates that temperature stability is paramount for this medication. If a temperature excursion occurs, the immediate next step is not to assume the drug is still good or to simply refrigerate it, but to contact the wholesaler or manufacturer. They can provide specific guidance on whether the product's integrity has been compromised, as an hour out of refrigeration could render some sensitive medications ineffective or harmful. Question 6. A prescription reads, hydrochlorothiazide 25 mg tabs, Sig, I-tab PQD number 30. How many days will this prescription last? I. 15 days. B. 30 days. C. 60 days. D. 90 days. Answer B. 30 days. This question assesses a basic but essential pharmacy calculation, determining the day supply of a prescription. The critical part of the prescription is Sig, I-tab PQD number 30, where I-tab PQD means 1 tablet by mouth every day, and number 30 indicates that 30 tablets are dispensed. If the patient takes 1 tablet daily and receives 30 tablets, the medication will last for 30 days. Accurately calculating day supply is crucial for billing and ensuring patients have enough medication until their next refill. Question 7. According to federal law, how often must a complete inventory of all controlled substances be performed in a pharmacy? I. Annually. B. Biennially, every 2 years. C. Monthly. D. Upon change of pharmacist in charge only. Answer B. Biennially, every 2 years. This question delves into federal pharmacy law concerning controlled substances, an area where precise knowledge is mandatory. The keyword federal law specifies the legal standard you need to recall for controlled substance inventories. According to the Drug Enforcement Administration, a complete inventory of all controlled substances, Schedules 2V, must be conducted at least every 2 years or biennially. This regular inventory helps account for all controlled substances and detect any potential diversion, ensuring compliance and public safety. Question 8. What is the beyond use date, BUD, for a non-aqueous compounded preparation according to USP less than 795 if no stability data is available? I. No later than 6 months or the earliest expiration date of any ingredient. B. 14 days when stored at controlled cold temperatures. C. 30 days at room temperature. D. 1 year from the date of compounding. Answer I. No later than 6 months or the earliest expiration date of any ingredient. This question tests your knowledge of compounding standards, specifically beyond use dates, BUDs, for non-sterile preparations as outlined by USP less than 795. The keywords non-aqueous compounded preparation and no stability data are crucial for determining the correct BUD. For such preparations, the BUD should not exceed 6 months or the earliest expiration date of any active pharmaceutical ingredient, whichever is shorter. Understanding these guidelines ensures compounded medications are stable and safe for patient use. Question 9. A prescription calls for 500 milliliters of 0.9% sodium chloride to be infused over 4 hours. What is the infusion rate in ml/hour? I. 100 milliliters per hour. B. 125 milliliters per hour. C. 200 milliliters per hour. D. 250 milliliters per hour. Answer B. 125 milliliters per hour. This question requires a fundamental calculation for intravenous. For infusions, a common task in hospital or compounding pharmacies. The keywords are 500 milliliters and over 4 hours, indicating the total volume and the total time for the infusion. To find the infusion rate in ml/hour, you simply divide the total volume by the total time. 500 milliliters/4 hours equals 125 milliliters per hour. Accurate calculation of infusion rates is critical for patient safety, ensuring medications are administered correctly and at the appropriate speed. Question 10. Which of the following drugs is a proton pump inhibitor, PPI, commonly used to treat gastroesophageal reflux disease, GERD? I. Furosemide. B. Sertraline. C. Pantoprazole. D. Warfarin. Answer C. Pantoprazole. This question assesses your knowledge of drug classes and their common indications, a core component of the top 200 drugs. The keyword proton pump inhibitor, PPI, refers to a class of medications that reduce stomach acid production. Pantoprazole, brand name Protonix, is a well-known PPI frequently prescribed for conditions like GERD. Furosemide is a diuretic, sertraline an antidepressant, and warfarin an anticoagulant. So knowing these distinctions is essential for proper drug identification and patient education. Question 11. What is the maximum number of refills allowed for a Schedule III controlled substance prescription? I. No refills allowed. B. 1 refill. C. 5 refills within 6 months. D. 11 refills within 12 months. Answer C. 5 refills within 6 months. This question tests your specific knowledge of federal controlled substance regulations, which are vital for compliance and patient safety. Schedule III controlled substances, such as Tylenol with codeine, have specific refill limitations. The law allows for a maximum of 5 refills within 6 months from the date the prescription was issued. Understanding these limitations is crucial to prevent diversion and ensure proper handling of controlled medications. Question 12. A medication recall notice is issued for a specific lot of ibuprofen 200 mg tablets due to potential contamination. This would most likely be classified as what class of recall? I. Class 1. B. Class 2. C. Class 3. D. Market withdrawal. Answer I. Class 1. This question examines your understanding of medication recall classifications, a critical aspect of pharmacy quality assurance and patient safety. The keyword, potential contamination, suggests a serious risk to health. A Class 1 recall is issued when there is a reasonable probability that using or being exposed to a violative product will cause serious adverse health consequences or death. Contamination that could lead to harm would certainly fall under this highest level of recall, requiring immediate action to remove the product. Question 13. Which of the following tasks is typically not permitted for a certified pharmacy technician to perform independently? I. Accepting a new prescription over the phone from a prescriber. B. Entering prescription information into the pharmacy computer system. C. Preparing a sterile 4-ad mixture. D. Dispensing a refill prescription to a patient at the pickup window. Answer I. Accepting a new prescription over the phone from a prescriber. This question assesses the boundaries of a pharmacy technician's role, particularly differentiating between tasks that require a pharmacist's professional judgment and those that can be performed by a technician. The keyword independently highlights tasks that do not require direct pharmacist oversight. Accepting new prescriptions verbally from a prescriber requires the interpretation and professional judgment of a pharmacist, making it a task typically prohibited for technicians to perform independently. Technicians are generally allowed to process and dispense under supervision, but not to receive initial verbal orders. Question 14. What is the proper storage condition for insulin vials that are not currently in use, unopened ED? I. Room temperature. B. In the freezer. C. Refrigerated 2 degrees C to 8 degrees Celsius or 36 degrees Fahrenheit to 46 degrees Fahrenheit. D. In a warm, dark cabinet. Answer C. Refrigerated 2 degrees C to 8 degrees Celsius or 36 degrees Fahrenheit to 46 degrees Fahrenheit. This question tests your knowledge of proper drug storage, which is fundamental for maintaining medication efficacy and patient safety. The keyword insulin is crucial because insulin is a temperature-sensitive biologic medication. Unopened insulin vials should always be stored in the refrigerator, typically between 2 degrees Celsius and 8 degrees Celsius, 36 degrees F and 46 degrees Fahrenheit, to ensure their stability and potency until their expiration date. Once opened, many insulins can be kept at room temperature for a shorter period, but unopened vials require refrigeration. Question 15. A patient needs 2 5 mg of warfarin daily. The pharmacy only has 5 mg tablets. How many tablets should the patient take each day? I. 1/4 tablet. B. 1/2 tablet. C. 1 tablet. D. 2 tablets. Answer B. 1/2 tablet. This question requires a simple dosage calculation, a common task for pharmacy technicians. The keywords are 5 mg daily, the dose needed D, and 5 milligrams tablets, the strength available. To find out how many tablets to take, divide the desired dose by the tablet strength. 5 mg/5 milligrams per tablet equals 0.5 tablets, or 1/2 tablet. Accurate dosage calculations are vital to ensure patients receive the correct amount of medication, especially for high-risk drugs like warfarin. Question 16. What does the abbreviation NPO commonly mean in a hospital setting regarding medication administration? I. Administer with food. B. Administer as needed. C. Nothing by mouth. D. Administer only in the morning. Answer C. Nothing by mouth. This question assesses your understanding of common medical abbreviations, which is essential for safely processing and interpreting prescriptions. The abbreviation NPO is a widely used Latin acronym standing for nil per os, meaning nothing by mouth. This instruction is critical for patients undergoing certain medical procedures or who have swallowing difficulties, indicating that no food, drink, or oral medications should be given. Misinterpreting such abbreviations can lead to serious patient harm, so always clarify if unsure. Question 17. Which federal act mandated that all medications have tamper-evident packaging after the Tylenol poisoning incidents of the 1980s? I. Poison Prevention Packaging Act, PPPA. B. Controlled Substances Act, CSA. C. Federal Anti-Tampering Act. D. Omnibus Budget Reconciliation Act of 1990, OBRA 90. Answer C. Federal Anti-Tampering Act. This question tests your knowledge of significant federal pharmacy laws, especially those enacted in response to public health crises. The keyword tamper-evident packaging directly refers to the measures taken after the Tylenol poisoning events. The Federal Anti-Tampering Act was passed in 1982 to make it a federal crime to tamper with consumer products and to require tamper-evident packaging for over-the-counter medications. This law significantly enhanced consumer protection and drug safety. Question 18. When preparing sterile compounds in a laminar airflow workbench, IFW, what is the minimum ISO class rating that the LAFW interior must meet? I. ISO Class 5. B. ISO Class 7. C. ISO Class 8. D. ISO Class 9. Answer I. ISO Class 5. This question tests your knowledge of sterile compounding environments and critical ISO classifications, which are essential for preventing contamination. The keyword sterile compounds indicates that a highly controlled environment is required. According to USP less than 797 guidelines, the critical primary engineering control, such as a laminar airflow workbench or biological safety cabinet, where sterile compounding occurs must maintain at least an ISO Class 5 environment. This high standard of air quality minimizes microbial and particulate contamination, ensuring the sterility of compounded products. Question 19. A patient presents a prescription for azithromycin 500 mg, Sig. 2 tabs pa on day 1, then I tab pa daily on days 2 to 5. How many tablets should be dispensed for this prescription? I. 5 tablets. B. 6 tablets. C. 7 tablets. D. 10 tablets. Answer B. 6 tablets. This question requires careful interpretation of a multi-step dosing regimen to calculate the correct quantity to dispense. The keywords are 2 tabs pa on day 1, 2 tablets orally on the first day, and I tab pa daily on days 2 to 5, 1 tablet orally for days 2 through 5. This means 2 tablets for day 1 plus 1 tablet / day * 4 days. Days 2, 3, 4, 5 equals 2 plus 4 is equal to 6 tablets total. Accurately calculating quantities for complex SIGs prevents dispensing errors and ensures the patient receives the full course of therapy. Question 20. Which of the following organizations is responsible for developing and disseminating quality standards for non-sterile and sterile compounding? I. Drug Enforcement Administration, D. B. Food and Drug Administration, FDA. C. United States Pharmacopoeia, USP. D. National Association of Boards of Pharmacy, NABP. Answer C. United States Pharmacopoeia, USP. This question assesses your knowledge of key regulatory and standard-setting bodies in pharmacy, particularly regarding compounding. The keywords quality standards for non-sterile and sterile compounding point directly to the role of the United States Pharmacopoeia, USP. USP is a non-governmental organization that establishes official standards for identity, strength, quality, and purity of medicines, including specific chapters like less than 795 for non-sterile and less than 797 for sterile compounding. Adhering to USP standards ensures the safety and quality of compounded preparations. Question 21. A patient asks the pharmacy technician, "What is this medication used for?" after receiving a new prescription for metoprolol. What is the most appropriate response from the technician? I. It's for heart conditions. B. It's a beta blocker. C. I can't tell you. Only the pharmacist can counsel on new medications. D. You should ask the pharmacist. They can explain its purpose and potential side effects. Answer D. You should ask the pharmacist. They can explain its purpose and potential side effects. This question tests your understanding of the scope of practice for a pharmacy technician, particularly regarding patient counseling. The keyword new prescription is crucial because counseling on new medications, including explaining their purpose and potential side effects, requires professional judgment and is a task reserved for the pharmacist. Pharmacy technicians should always refer such patient questions to the pharmacist to ensure comprehensive and legally compliant patient education. Question 22. What is the primary purpose of a red book in a pharmacy? I. To identify controlled substances. B. To find average wholesale price, AWP, and other pricing information for prescription drugs. C. To list all FDA-approved drugs. D. To track medication errors. Answer B. To find average wholesale price, AWP, and other pricing information for prescription drugs. This question assesses your knowledge of common pharmacy references and their practical applications. The term Red Book is a common nickname for a specific pharmacy reference guide, and the keyword pricing information is a strong clue to its primary function. The Red Book provides comprehensive pricing data for prescription and over-the-counter drugs, including average wholesale price, AWP, which is often used for reimbursement calculations. Knowing how to use such resources is essential for efficient pharmacy operations and billing. Question 23. A technician is reconstituting an antibiotic that requires 75 milliliters of sterile water. The measuring device available only has markings for fluid ounces. How many fluid ounces of sterile water are needed? 1 FL/Oz equals 30 milliliters. I. 1, 5 FL/Oz. B. 2 fluid ounces. C. 2, 5 FL/Oz. D. 3 fluid ounces. Answer C. 2, 5 FL/Oz. This question requires a conversion calculation between metric and apothecary/household units, a practical skill in pharmacy settings. The keywords are 75 milliliters and the conversion factor 1 fluid ounce equals 30 milliliters. To find the equivalent in fluid ounces, divide the milliliter volume by the conversion factor. 75 milliliters/30 milliliters per fluid ounce equals 2, 5 FL/Oz. Accurate conversions are essential to ensure precise medication preparation, preventing dosage errors that could harm patients. Question 24. What is the primary function of a medication guide, med guide, which is required for certain medications? I. To provide a comprehensive list of all medications a patient is taking. B. To inform patients about serious risks, proper use, and other important information for specific drugs. C. To summarize the pharmacist's counseling points. D. To serve as the official prescription label. Answer B. To inform patients about serious risks, proper use, and other important information for specific drugs. This question focuses on patient education tools and federal regulations related to specific high-risk medications. The keyword medication guide, MedGuide, indicates a specific type of patient-friendly leaflet required by the FDA for certain drugs, e.g., isotretinoin, NSAIDs, some antidepressants, when they pose serious risks or have complex instructions. Its primary purpose is to educate patients directly about important safety information, proper administration, and potential side effects, ensuring they use these medications safely. Question 25. A pharmacy technician observes a pharmacist removing outdated medications from the shelves. This activity is a crucial part of which pharmacy operation? I. Inventory ordering. B. Dispensing. C. Quality assurance and inventory management. D. Patient counseling. Answer C. Quality assurance and inventory management. This question highlights the importance of maintaining proper stock and preventing errors in a pharmacy. The keyword outdated medications is critical because expired drugs can be ineffective or harmful. Removing these medications is a key component of both quality assurance, ensuring only safe and effective drugs are available, and inventory management, as it involves tracking and culling stock. This practice prevents dispensing errors and maintains the integrity of the pharmacy's medication supply. Question 26. Which of the following drugs is a common antidepressant that is also often used for smoking cessation? I. Metoprolol. B. Bupropion. C. Amlodipine. D. Alprazolam. Answer B. Bupropion. This question tests your knowledge of common drug indications and their therapeutic uses, particularly for drugs with multiple applications. The keywords antidepressant and smoking cessation are key indicators. Bupropion, brand names Wellbutrin, Zyban, is a unique antidepressant that is also effectively used to help patients quit smoking. Metoprolol is a beta blocker, amlodipine is a calcium channel blocker, and alprazolam is an anxiolytic, none of which are primarily used for smoking cessation. Question 27. What does the term formulary refer to in the context of prescription insurance and pharmacy benefits? I. A list of all medications manufactured in the United States. B. A comprehensive database of drug-drug interactions. C. A list of preferred medications covered by a specific insurance plan. D. The legal framework governing drug prescriptions. Answer C. A list of preferred medications covered by a specific insurance plan. This question assesses your understanding of pharmacy billing and insurance terminology, which is vital for processing prescriptions correctly. The term formulary refers to a list of prescription drugs covered by a health insurance plan. These lists are often tiered, meaning some drugs may have a lower copay than others, and they can influence prescribing decisions. Understanding formularies is crucial for technicians to help patients navigate their prescription costs and ensure proper adjudication of claims. Question 28. Which of the following is an example of tall man lettering used to help prevent medication errors? I. Insulin glargine. B. Metformin and metoprolol. C. Acetaminophen. D. Penicillin VK. Answer B. Metformin and metoprolol. This question tests your awareness of specific patient safety strategies, particularly for preventing look-alike/sound-alike errors. The keyword tall man lettering refers to the practice of using mixed case letters, e.g., lowercase and uppercase, to highlight dissimilarities in drug names that look or sound similar. This visual cue, like in metformin and metoprolol, helps differentiate between high-alert medications and reduce the risk of dispensing errors. It's a key strategy advocated by organizations like the Institute for Safe Medication Practices, ISMP. Question 29. A new prescription for a Schedule II controlled substance is received. According to federal law, when must this prescription be filled? I. Within 7 days of the written date. B. Within 30 days of the written date. C. There is no federal time limit for filling Schedule II prescriptions after the written date, though state laws may vary. D. It must be filled within 6 months of the written date. Answer C. There is no federal time limit for filling Schedule II prescriptions after the written date, though state laws may vary. This question focuses on specific federal regulations for Schedule II controlled substances, which are known for their strict controls. The keyword Schedule II controlled substance, e.g., oxycodone, Adderall, indicates that unique rules apply. While many states impose a time limit, e.g., 60 or 90 days, federal law itself does not specify a maximum time frame after the issue date within which a Schedule II prescription must be filled. However, pharmacists must still determine if the prescription is legitimate and for a legitimate medical purpose. Question 30. A patient drops off a prescription for a transdermal patch. What important counseling point should the technician be aware of for a pharmacist to convey? I. The patch should be cut in half if the dose is too strong. B. The patch can be reused multiple times. C. Apply the patch to a clean, dry, hairless area of skin and rotate application sites. D. Apply the patch orally with water. Answer C. Apply the patch to a clean, dry, hairless area of skin and rotate application sites. This question assesses your knowledge of appropriate administration techniques for different dosage forms, which is vital for patient safety and medication efficacy. The keywords transdermal patch identify a specific route of administration with unique requirements. Patches deliver medication through the skin, so it's crucial to apply them to clean, dry, hairless skin and to rotate sites to prevent skin irritation and ensure consistent absorption. Cutting or reusing patches, or applying them orally, would be incorrect and potentially dangerous.